Hello, I'm Mark Ells, Barnstable Town Manager, and this is my community update. We're still proceeding through the phases of the COVID situation, and the primary focus at this point by all is vaccination. And following my update, Assistant Town Manager Clyburn is going to provide you an overview, and he is going to explain that the primary issue at this point is supply of the vaccine. Certainly here in Barnstable, we're ready to administer the vaccine as soon as we receive it. We ask you all to remain patient. We also ask you to continue to listen to what's being said at the federal and state level, and certainly, daily there are changes. Here on the Cape, we are seeing somewhat of a flattening. We're not still in an increasing mode relevant to positive cases. Hopefully, as we vaccinate our public, through all means, we have large scale facilities and county and state and private and town. As the vaccine becomes available, as we vaccinate, we will see those numbers continue to hold and go down. In the meantime, I have to remind everybody to continue to follow the proper protocols. Please continue to wear your face coverings, your mask, washing your hands, um, maintaining proper distancing, and please stay home from work, school, sports, other activities when you don't feel well. What's been said to us is that there's a very low incident this year of normal flu, winter type flus, probably because of the protocols we're following. But typically, when somebody doesn't feel well, it is this virus. So please be aware of that. And if you don't feel well, abstain from whatever you were planning on doing. So we're going to go to the assistant town manager in a minute. I do want to ask you, if you have time, to go on our website. I've talked with you in past weeks about us moving forward with our comprehensive wastewater management plan. Well, on our website, on the Town of Barnstable website homepage, over on the left-hand side, there's a new box that says Barnstable Clean Water. And within that, we're going to be, well, we have put, but we're going to be putting all of the information relevant to the discussions we're going to be having with our community over the coming months. So please, if you have time, click on it and take a look, and please ask questions. And at this point, I'll stop and thank you for listening, and stay well.
Good evening, Mr. President, Town Councilors. I'm Assistant Town Manager Andy Clyburn, here to give a brief update on COVID-19 vaccination. Also here with us is Chief Peter Burke to help answer any questions you may have this evening. I want to start with the bottom line up front. There is a shortage of COVID-19 vaccine. Locally, we are prepared to administer as many doses as the state is able to provide our community. We have put a tremendous amount of effort into planning for every possible scenario of vaccine availability. We simply need more supply. We are well aware of the anxiety limited supply causes, and we understand people are tired of being told to stay patient. Unfortunately, that's part of the message we need to deliver. It will take time, more time than any of us wish, to provide vaccinations to every individual that wants it. But we will get there, and no one will be left behind. Healthcare workers got vaccinated, as did first responders and others in phase 1, but those numbers were small and vaccine was readily available. As you all know, the Commonwealth of Massachusetts has a 3-phase plan governing the COVID-19 vaccination rollout. This is the playbook, and we have no path around it. 2 weeks ago, I walked you through the various states which still apply. Our local website, county website, and state website are still the recommended sources of information. Won't spend too much time this evening going over the phases and projected timelines as they continually change. Phase 1 vaccination includes healthcare workers doing COVID care, long-term care facilities, rest homes and assisted living facilities, first responders, congregate care facilities, including corrections and shelters, home healthcare staff, and other healthcare workers doing non-COVID care in that order of priority. The projected timeline was phase 1, December through mid-February, phase 2, February through April, and phase 3, April through June. One significant change that has occurred to the rollout plan was jumping into phase 2 on 1 February. As I'm sure you're all very aware, all citizens over the age of 75 are now vaccine eligible. They are the #1 priority in phase 2. We ordered doses to begin phase 2 vaccinations as soon as the Commonwealth gave the green light to do so. We order doses every week and will continue to do so every week. Unfortunately, we have not received any phase 2 doses to date. Barnstable County has received a very limited amount of vaccine and has made it available through the state mandated system for holding vaccination clinics. We're very fortunate to have a great relationship with the county, and one of their distribution sites is in our town at the Melody. Today, 375 phase 2 eligible citizens received their first dose of vaccine. That is great. Put it in context, we have 6,000 citizens over the age of. We need more supply. Unfortunately, the statewide system to get vaccination appointments was constructed to push the maximum amount of vaccine out to the community as it becomes available. It was not set up to instill any sense of confidence that those trying to get an appointment would be able to do so if the supply became limited, which obviously it is. In fact, I go as far as to say it was set up such that pushing limited amounts of vaccine out would undoubtedly fail in the court of public opinion, particularly with senior citizens. By declaring that everyone over the age of 75 would be vaccine eligible when the supply to vaccinate that group is on the order of 10%, somewhat of a recipe for disaster. We've all heard about how difficult the state registration side is and how frustrated everyone has become trying to get an appointment. But it should have been a foreseeable outcome. Even if we had extremely knowledgeable volunteers assigned 1-to-1 to every single person over the age of 75, the end result of trying to get an appointment would be no for 90%. So 9 out of 10 people would be unhappy. How do we fix that? Simple answer is get more vaccine. Unfortunately, we have no control over it. Locally, we do our best to amplify our message up the legislative chain. We are ready and we need more supply. For anyone that was not able to listen to the discussion that Senator Sear hosted last night with the 65 and over community, I would strongly encourage you to listen to it at your convenience. Be found at www.senatorsear.com. Locally, we will do our very best to alleviate angst in the community by ensuring everyone we will do our very best to make the process as good as possible, given the playbook we have been given and the supply that we receive. Transparency is important. We will communicate widely each time we receive a vaccine supply. We will give as much notification as possible prior to the vaccine registration being open. We'll help those that need it to register for those appointments, and we'll do our best to reassure those that don't get an appointment that they will not be left behind. Everyone over the age of 75 that wants a vaccine will get one before we move to the next phase. While we have a multitude of plans in place, none of them work without vaccine supply, period. We can dive into any of the plans if you want. However, until we have an idea of the vaccine supply, it could potentially do more harm than good. We don't want to push out information on any particular scenario just to have that plan not come to fruition and further confuse citizens.